Back here at home, glimmers of hope in North Carolina. We can tell you those COVID numbers are still trending up, but they could start to be slowing their pace. We're seeing some signs of that. More than 18,000 people testing positive for COVID in the state, 32% of tests coming back positive. Certainly some high numbers. North Carolina breaking another hospitalization record with nearly 4,900 people in the hospital statewide with the virus. But we mentioned some potentially good news here. It seems as though hospitalization rises are slowing, so it's not going up quite as fast as we saw before. The average daily patient increase is about a third of what it was 3 weeks ago, and that was the most recent peak rise in patients.
And although this variant is not causing as severe illness as Delta, we know this sharp rise in cases is hitting hospitals especially hard. That's why Atrium Health and the North Carolina Department of Health and Human Services requested more help from FEMA. WCNC Charlotte's Chloe Leshner live at Atrium Health in Dilworth. Chloe, what can we expect to see in hospitals in the next few weeks?
Hey, Fred. Well, throughout the pandemic, hospitalizations have always lagged a bit behind increases in cases. So while some doctors think that Omicron could push us closer to that endemic phase, the hospitals will not feel that relief just yet. Omicron continues to spread at a rate not seen before in the pandemic, but there are some small signs of hope.
But I'd say we're starting to plateau. We haven't yet turned the corner like some parts of the country have and seen a true decline as of yet.
Record-breaking case counts and percent positivity rates can help get immunity to a place where the pandemic becomes more manageable, but there is a short-term price to pay.
We will certainly bear the pain of this surge to some degree with hospitalizations and deaths, despite the lower case fatality rate.
Hospitals are overwhelmed after another record-setting day met with continued staffing shortages. Atrium Health joining with the North Carolina Department of Health and Human Services to request federal resources from FEMA, specifically needed in the Charlotte area. The health system is above 95% capacity. They're asking for more nurses to work the front lines. Experts pushing more people to get vaccinated to prevent this from happening again from another variant.
ICU docs and nurses have been first responders have been our true heroes in all of this. And the capacity for them to continue to respond to surges is going to no doubt be diminished. And so we need to replete that workforce, particularly during these surges, so that we can tolerate those.
A representative from the state tells me that request to FEMA is in process and they are still waiting to hear more on if they will be given those resources. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Chloe, thanks.